became a dentist because when I was in high school, our family switched from that really old, outdated dentist to the young guy right out of school with a beautiful office. And I was shocked that they were the same profession. I mean, I really dreaded the dentist before, and then I loved going to the dentist. And I could not get enough of asking questions while I was there. And he became quite the mentor to me, and I decided to follow in his footsteps. I did a GPR in Allentown, Pennsylvania. You know, I had gone to Temple Dental School, Villanova undergrad, Temple Dental School. Then I went on to a GPR at Sacred Heart Hospital in Allentown. And after that, I worked as an associate for a couple of practices, and then found John Nungesser, who is the wonderful dentist who was retiring from this practice. And I was able to start with a nice small practice that I could afford, and over the next 30 years, continue the growth. My favorite part about being the dentist is the relationships. I love the relationships, but I also love the ability to be able to create health and beautiful smiles that give people the confidence they need to go out and live their life. You know, people wake up every morning, first thing they do is look in the mirror, right? I want them to be able to look in the mirror and just like be able to take on the world. I love clear aligner therapy. I have a background in ortho, and I've done ortho for years, and I've almost got it all to clear aligners at this point because I really believe and I see what it can do. So I love to work my magic with clear aligners and then be very conservative with any kind of porcelain work I have to do. So I love putting teeth where they need to be. I love the beach, I do. I spend a lot of time in the summertime at the Jersey Shore, and we have a boat, and my favorite place to be is out on the water. So I have 2 golden retrievers. They're usually in the boat with us, and we're having a great time. I think what makes my practice unique is I have an airway-driven thought process. So everything I do is really about how can I create healthy, beautiful smiles, but improve the airway at the same time. So I think it's this holistic approach that I have. So I'm not just looking at a tooth. I'm looking at a whole system, a whole person, a whole state of health. I'm looking to incorporate all of that in my treatment plan, and I think people understand that about me and value that in our relationship.